Hello, seagulls. It's hard to believe that it's February already. I really enjoyed seeing our beautiful campus with the wintry weather we've experienced over the past week. But I've also been grateful that the snow has melted off the roads practically overnight. I have a couple of updates regarding testing and vaccines. Then we have a special guest joining us today, Lori Brewster, Health Officer for the Wicomico County Health Department. So first, regarding testing. Our positivity rates are well under 1% this week. This continues to be great news. Please continue wearing masks, maintaining social distance, washing hands, and isolating when necessary. This all keeps our rates low. Thank you for also participating in our testing protocols. All students and employees still must have an SU-administered COVID-19 test within the past 30 days in order to maintain campus access. This is the same as last fall. Testing continues in the Great Hall. Sign up now for February dates. My test is coming up on Tuesday. You should schedule yours right now. Now, regarding vaccines, some members of the SU community are eligible for vaccines, according to the state of Maryland guidelines and based on roles on campus. We're working with the Wicomico County Health Department to notify individuals on campus when appointments for those who are eligible become available. If you receive an email from Campus Health saying that you're eligible, I encourage you to sign up immediately. All of us are doing our part to get vaccinated, and that will help prevent the virus from replicating and mutating. Okay, at this time, as I mentioned, I'd like to introduce Lori Brewster. Lori, welcome, and thank you for taking the time to join us and to share information on behalf of the Wicomico County Health Department. We have a few questions for you today.
Okay.
First of all, how are positivity rates going in the county?
Our positivity rates are going in the right direction. We are declining just about every day. We're at 8.72 today, which is great. Considering when we had the holiday spike, we were close to 20%.
Wow. Tell us why it's important for people to get vaccinated as soon as they have the opportunity.
As people are eligible, getting vaccinated will actually help them as well as help the community with the community spread of the virus. The current vaccines that are being used are about 95% effective in combating COVID virus transmission. So we need to get people vaccinated as soon as possible.
Great. Can you shed some light on the vaccine rollout? Who's eligible? How do they get appointments? What's the availability of the vaccine like right now in Wicomico County?
Sure. So the state of Maryland sent their plan into the Center for Disease Control back in October, and it's been tweaked a little bit since that was submitted. And it's a pyramid system starting with various phases. Phase 1A consisted of first responders and healthcare workers, particularly those that are on the front lines doing the vaccinations and caring for the COVID positive patients in hospitals. Then there was 1B, which was targeting individuals 75 and older, as well as educators, so that we could get students back in school, which is currently in place, and SU has been able to keep students in school, which has been great. They also opened up 1C back on last Monday, and that consisted of individuals 65 and older, and a lot of individuals that fall within the critical infrastructure sectors. Unfortunately, there's not enough vaccine for us to vaccinate all of the individuals in all of those phases, so we have been focusing on those individuals that are 65 and older, healthcare workers, as well as the educators in the community.
Well, thanks. It sounds like things are really picking up steam very quickly. What can you tell us about eligibility for members of the SU community?
So right now, we're sending the links to the different educational facilities. So we send a link to SU on a weekly basis for the appointments. And SU determines who needs the vaccine, and they have a list of individuals to send the link to. And we are currently allocating 100 doses per week to the educational groups that fall within the categories for vaccine. And next week, we're going to expand that so that we can hopefully get additional individuals of the educational community vaccinated.
Oh, that's great. So the health department has been really consumed by COVID for the past year or so, but tell us about the other resources that the health department offers that might be of interest to SU faculty, staff, and students and parents.
So the health department has a large cadre of services that we offer. We have things that fall within our community health services division, which includes reproductive health services, sexually transmitted infections, immunizations, migrant health. We also have home visitation programs that fall within there for individuals that are postpartum and have children that they need to have seen in the home setting. We do a number of visits in the community, both with community health services as well as our behavioral health services. We have a large behavioral health program that serves individuals that are suffering from mental health or substance use services. We have an environmental health program that provides well and septic evaluations. We provide restaurant inspections to make sure that the food that people are serving in restaurants is safe for consumption and they are taking all precautions. We also have, within the environmental health division, our community health sector in which they do pool inspections as well as rabies. They deal with rabies vaccine, but they also do reviews of animal bites. So you'll see if there's a rabid animal in the community, you'll see that we have a press release that goes out about that. And then we have a very large prevention program that focuses on numerous types of services such as tobacco cessation, as well as substance use prevention. And we are very grateful to have those services. And we have some SU students that work with us, and we're very grateful for them.
That's great, thank you. It sounds like you and your staff are very, very busy people. Does the health department have any specific requests for students and SU employees as we return for the spring semester? How can we help?
Just continue doing the work that you've been doing with requiring people to wear masks, socially distance, wash your hands. And I'm so grateful that the university has been doing that with and keeping the positivity rate of the college or the university campus so low.
Well, I'm grateful too, thank you. Is there anything else that you'd like to talk about?
Just appreciate the partnership that we've had and with SU, and I think that has grown over the past almost a year. And we could not do this without partnerships in the community, and I think it's great that we have this partnership. In addition, just wanted to let people know the health department is not the only place that they can get vaccine. You can get that at your local Walmarts, Sam's Club. They're expanding to Rite Aid next week, but I'm hearing that we don't have a Rite Aid in Wicomico County they're eligible. But also Tidal Health has got vaccine that they are administering as well. And in order to get the vaccine, you just need to send a email to the health department to wicomico.covidvax, V-A-X, at maryland.gov.
Well, thank you, Lori. And I'd like to thank you and the entire Wicomico County Health Department for its continued partnership, especially over the past year. We applaud everyone on your team for working as hard as possible to promote public health in the best interests of our communities during this pandemic. Thank you for joining us today.
Thank you.
Okay, I have a couple of other items to discuss. First, tomorrow is National Wear Red Day. This is observed on the first Friday of February to raise awareness about heart disease, especially among women. Human Resources has invited the campus community to attend a webinar with Dr. Jennifer Hart in the School of Nursing and Dr. Laura Marinaro in the School of Health Sciences. They will share information and respond to your questions. Show support for this Friday and wear red. Second, the university is also commemorating African American History Month all February long. A variety of events are planned, including virtual panel discussions, a concert, poetry readings, and book and film discussions. Our inaugural SU Anti-Racism Summit tomorrow is full, completely sold out, with more than 500 students, faculty, staff, and others signed up to attend. Please visit our website to find out more about these and other spring events. And finally, I hope you'll join me at 4 p.m. today for our quarterly SU Town Hall. This one co-hosted by the Student Government Association and the Graduate Student Council. The discussion will include COVID-19, but also many other questions on university topics that we've received via email. A link to view the town hall will be on our website. Okay, at this time, I'll take any questions you may have. As always, please send them via email to stayinformed@salisbury.edu. Eli Maudlin, what are people asking about today?
Thanks, Dr. White. The first question that came in is regarding the COVID testing policy and kind of has to do with vaccines. After someone is vaccinated, first or both doses, do they still have to get tested at SU?
Yes, indeed. There's several reasons for this, but the vaccine, most of the vaccines do not necessarily prevent the spread of disease, and so we still have to do all of the protocols, wearing masks, social distancing, and practicing hand hygiene, because the vaccines aren't 100% effective. And so we will all continue to do that until the incidence of COVID in our community is greatly, greatly diminished.
Thanks, Dr. White. The next question is about graduation, commencement. Could you talk a little bit about how the planning is going for May commencement?
Sure. We are planning a completely safe commencement exercises this spring. As always, it's somewhat uncertain about what the progress of the disease is, but it's important to remember that right now, even though case rates and hospitalizations are starting to come down from the all-time peak, they are still very, very high. And it's going to be a while before we can safely have large gatherings like a commencement. So for right now, most of the planning that's going into commencement has been geared toward a virtual exercise.
But just to clarify, there is the possibility, depending on...
Yes, of course. If the vaccine is very effective and the rates come down, then we could imagine an in-person, at least an in-person component to commencement.
Thanks, Dr. White. Are students in certain programs going to be eligible for the vaccine as it becomes more widely available?
Yes. Right now, there are some students, for example, some student employees at SU who are eligible as a result of the roles that they play. Some students are actually frontline workers as a result of doing clinical rotations. Some students have been volunteering in the community and have been eligible for that reason. So yes, as far as I know, there aren't any student groups that have become eligible just because they are students, but there are lots of students who have been eligible for other reasons.
Thanks, Dr. White. All the questions for today.
All right. Well, okay, Seagulls, I think that wraps up our briefing today. To conclude, I'd like to show a brief clip of our campus and classrooms as our semester got underway last week. It's great to see our students, faculty, and staff in action safely. Please enjoy and join me next week for our live briefing again next Thursday. Thank you.